the private sector involvement and all the investment in the country and all of that, we start catering to that investment. And we forget about the nation building pillars of health and education and agriculture. And we start losing the best of our young people and talent that could go and be excellent doctors and nurses and teachers into being technology, MBA,
Hmm.
other
Hmm.
careers that are positioned as being shorter to train and
Hmm.
that you will get better pay. We're in that situation, and I hope that Africa doesn't fall through those cracks and really protects the health and the education and the food security of its people, because that's where the future of any country goes. But we really have to be very careful, and that's where when we need different ways of addressing with entrepreneurship, social entrepreneurship, social impact funds, and issues of that nature.
Yes, absolutely. And of course that's brings me down to Genos Global
Hmm.
Consulting. And
Hmm.
of course that's the objective, that's the mission of that project. Now, how did that come along? How
Well,
did that come about?
Genos started in Brazil in 1993 as
Okay.
a way to train. At the beginning, the funding was starting to come into Brazil for HIV,
Hmm.
and we didn't have really strong NGOs. We had fledgling community-based projects, and so Genos came to be able to strengthen the capacity of community-based programs and NGOs and governments, local governments, to be able to respond to HIV throughout the whole continuum of care, from prevention to care and support. And so it had a social mission from the very beginning.
Right.
Genus, of course, when I started my international career and my associates also did that, Genus went into a pause.
Hmm.
And then years later, when I returned to Panama, something, I'm talking about the career. So I had my first career as a doctor, doing what doctors do, the second career, the global health.
Right.
And then I was up there. I was, at the UN and all these, discussions about macro politics and macro financing. And I'm like, I'm not happy here. I want to go back to basics. I want to go back to really feel and that I'm influencing in the life of people. So I decided, but I said it's time for a third career, but I didn't know what it was.
Hmm.
So I decided to come back to Panama after 33 years, just for a personal sabbatical of 6 months to decide what I was going to do when I would grow up. And then my dad falls ill and he passes away that first year. That I see my mother. I said, you know what? I can't leave. So that's when I relocate to Panama. And I continue my life in my international global health career, but more now as a consultant. But I started experiencing the difficulties of aging and the lack of resources and of solutions that we had not only in Panama but the rest of Latin America to respond to a very rapid aging. I mean, Latin America is considered the region that is aging the fastest in the world right now. So that's when I resuscitate, if you will. I reactivate Genos
Hmm.
now as a global enterprise, not only for my global consulting, but also to have a base to start spearheading and troublemaking, saying, well, let's start grabbing the bull by the horns. Let's start learning about technology and health and aging and through Genos. Think of Genos as a social sort of mm, engine
Okay.
that just wants to create a better world. So, so through it, we work with the universities, we work with government, we work with NGOs. Um, and in Panama, we have a couple of projects like East Silver that you mentioned, that it's more like a social lab of how do you bring together not only health, but from the perspectives and the needs and the priorities people over 60, which is not necessarily health. The first one that comes all over the place is financial security. People need money to survive. Second one is food security. The third one is breaking loneliness, and the issues that surround emotional and mental health. And then comes health as a whole. So we put all this together in this ecosystem that builds social enterprises, intergenerational social enterprises. We
Right.
need young people involved working with older persons. We're starting a project with Brazil now. It's a 5 year project. It's a hackathon that was started in Brazil for to get young girls from vulnerable settings to get interested in financial in STEM careers, and we're replicating it now in Panama, but as an intergenerational initiative with young girls from impoverished settings,
Mhm.
with women over 60, and they have to, and the hackathon has to think about silver economy solutions, and we're coming in through the focus of financing, because it's a priority not only for the elder
Mhm.
population but
Mhm.
also for the young people. And starting, we have a this is done with the Oswaldo Cruz Foundation from Brazil, which is the largest public health foundation in the Americas. And we have a 5 year program. And starting in 2024, we're going to focus in Central America and the Caribbean, always with the idea of intergenerational women and young girls groups to find technological solutions to address the needs of aging through a silver economy lens.